Welcome back, Men's Couch. We're here today to talk about the topic of therapy and how that relates to men. I'm going to be answering some questions like should men do therapy or um, how can therapy be beneficial to men? Here with me as your one of your hosts, Micah. I'm here speaking. Here with me today is
Anthony.
And Morris.
and we're here to talk about the topic of men in therapy. I guess I can start off with like kind of sort of my beliefs around the topic. Um, I think I think it's becoming a lot more normalized to do therapy now than it ever was, and I think and especially I want the podcast to be part of the movement of normalizing that of men going putting themselves out there and getting the help that they need. But yeah.
Yeah, I feel you as well. Like, I definitely noticed that. It's definitely more acceptable to go to like therapy, not for just men, but for just people in general. Cause like, there's kind of like a taboo around it. You're seen as like a little different, or you're seen as like something's off with you if you're going to therapy. I feel like it's definitely been more accepted. Finding help and getting professional opinion about like whatever your mental is going through, and just having somebody to talk to who actually has like knowledge in that field to where they actually can help you and provide like assistance to your mental state and understand your situation more deeply, because it's more than just surface level sometimes.
Yeah. Yeah, I agree with that. I feel like having that feedback from someone that is more neutral is a lot more beneficial than maybe just going to a family member or a friend because, yeah, the family and friends are helpful, but they see it from like their more biased way of what they think that you should do about your mental health, and it's not always the best advice or the best thing you should do. Um, I what are I don't know if I want to ask this yet. Something that like is coming to mind is um, why when it comes to therapy, why is like I don't know like statistics, but why do we think men are less likely to go to therapy?
So I think the matter of fact of looking tough, like not many people want to talk. Not many men want to talk about them, like push people away.
Yeah.
Or
As someone who's been through therapy for like a good amount of my life, it's definitely like approaching it just seems like you like I don't even want to do this. Like you just don't
Mm-hmm.
think it's gonna help. Sometimes you just like I can figure it out by myself. Like
Yeah.
you don't really feel that I need somebody else to fix my problems type deal. It's
Okay.
usually just like whatever I got going on in my life, I can figure it out by myself. And like I don't really need somebody to just tell me that I got something wrong with me when I know, I got something wrong with me already. So like why should I go get like pay money and get help for something that I don't think I need? Like that's usually what the mental is when with men or just like with anybody for real. But like that's where I've come from a few times. Yeah, definitely.
So do you think it's more of men thinking that we need to be self-sufficient or not like self-sufficient but more like self-reliant then?
Somewhat. Yeah, I feel like not only that, I feel like some people just don't feel like going out of their way to go do that because like
Mm.
I already got a packed schedule. Why should I go take like an hour just to go talk about my feelings with somebody when I could just go home talk to my friend or something? Like it's
So
just
is it the idea of like what therapy is?
yeah. Therapy is it's not easy either.
Oh no, it's not easy.
You gotta be there. You gotta do it consistently. You have to make progress. It's just like you hear all that. You just like I don't want to do it. I want to like get results now. Like I don't want to keep going once a week or keep going twice a month just to
Mhm.
talk about something is like, it just feels like hassle sometimes. I can definitely understand that point.
So so it's like more like we think it's not effective,
Not worth it,
not worth it. Okay. Okay.
you know.
For the longest time, I didn't think it was going to be very effective because as a man, you grew up as being self-sufficient and trying to figure out things on your own.
Yeah. That's kind of like, yeah, that's also how I grew up is kind of to that if I had something, I didn't really necessarily go to my parents. It was more of my sister did that because I was just taught to be strong in like kind of how you are. So that means like being strong, I guess to me like growing up that meant like that sharing what was going on meant that I needed help, but I can't admit that I need help because I need to do things all by myself.
Yeah, definitely. It's just, as I said, I was like in and out. Like, damn, I'm no mostly through my life. So I just like when I was a kid, I was real stubborn. Like I didn't like people certainly. Like there would always be a school counselor or somebody, and they'd always ask the same questions. I'm just like
Angie's
it's just
welcome Angie.
and I'd just be like, because sometimes you don't connect with your therapist. Like you don't have to connect with everybody, but like it definitely takes like finding the one, like finding the person that you can like be comfortable with. And it definitely took me years to get there with a certain person. And I only had like one real therapist that I was like real chill with. But a lot of them felt to me like they were just like asking generic questions. Like they didn't even.
Like they're just asking like questions, but not really understanding who you are.
Yeah, not really understanding who I am. So I just ignored them. So like I'd just go there and I'd be like, I'm not getting anything from this because like they're just saying the usual things. Like it was just like copy and paste. Like it didn't feel like
But
actually wanted.
It doesn't like help your situation. They weren't really like helping your situation.
They were just like
more like kind of like going from like a book of
like
coping skills.
How do you feel? Like why does this make you feel that way? Try not to feel that way. And it's like some of them you definitely like. There's 100% a different quality between all therapists, and definitely finding that therapist that works for you is very important because if you can find one that you like have a synergy with, it's a lot more beneficial than just like finding any random therapist that you just like who just doesn't click with you.
Yeah. On a side note, we have Angie here today.
Hey guys, I'm back.
She's back. Yeah. So Angie, we're talking about like what do we think about men doing therapy, and like should men do therapy, or kind of like that.
Yeah, I think everyone should do therapy regardless of gender. I've actually met a couple of guys who have like started their journey of like going to therapy.
Yeah, that's
and
awesome.
And something that I hear a lot is like, oh, like the first time like it didn't work out and they get discouraged.
Yeah,
and
that happens
like
a lot.
Kind of
like
what you said about like how it's sometimes hard to find the therapist right for you, because a lot of people probably go to therapy for the first time and they think that that's going to be like that is going to be the therapist.
Mm-hmm.
But for like most people, you typically have to go through like a bit and like trial and error and find the one that best fits you.
Yeah.
And that like fits your needs, because there's probably like therapists out there who probably just like check off marks, but they probably
really,
don't
like,
have a genuine connection with their patients or like the care to actually like try and fix something,
Yeah, usually those ones that like just felt like they were checking off a box. They were always from school for some reason. They were always like prescribed to me from school. They would be like, Morris is acting a bit weird or has like weird drawings or something. Let's just get him somebody that could just like ask him if he's okay. And I'm just like, I don't like you.
And I feel like when it's more voluntary, when you're when you kind of start out your own journey, when it's voluntary, I feel like it's also more effective because you're more likely to be with a therapist that matches well with you. When I started years ago, um, it wasn't like likely like my journey. I didn't have to like even though changed therapists, but that was like for a different reason. I didn't have like I always like meshed well with them, but still, I still had to go in like voluntary, and I think that's like where maybe men have a problem with therapy is that
Mhm.
we need to believe in therapy, if that makes sense, instead of like maybe like we can be encouraged by other people, but we have to believe that it's effective, and that's kind of like what we did in the intro of like is what is stopping men from doing therapies that we don't think is effective.
I mean, with most things, like the first step is just realizing you need help.
Mhm.
Like
Yeah,
you can't.
or maybe that's the first step.
Yeah, that's the first step is realizing you need help. You need to like genuinely you need to realize that you need to take something away from this experience. Like you can't go in there and be like, I'm not going to get anything from here. You have to be open minded. So like once you go into therapy, you know, you gotta I say like just try to like break down your walls a little bit so you can like absorb what they're trying to give you so you can understand
So
where
listen.
they're coming from. Yeah, you got to
Yeah.
listen, you got to take that information and just make sure you get help because like I remember specifically right before I went to this one therapy session, my sister was just like just learn what you can, you know, like try to get the help that she's trying to give you, you know, like you just need to accept it basically.
Yeah. So it starts from that place. I'm interested to know what you have to say about that. I don't know how like you don't have to share it. I don't know how like how much experience you had with it, but you know, I'm just like interested.
I mean, I just started therapy like not too long ago. Like,
Okay.
so I'm just starting my journey.
Oh,
But
okay, cool.
what held me back at first is that just I knew that I needed help.
Yeah.
I did, and I was in dire need. But
Yeah.
it's just the fact that when I went to people, I wasn't sure if they would care or not.
Oh, okay. So is that mindset of are my issues big enough to go into therapy? Maybe that's like what's stopping us is that we think we need like such a big issue or something
Yeah.
to even go in the door.
It usually
Light bulbs.
Usually, like with my experience, it comes from like somebody outside. It'll be like somebody outside, like a family member, or somebody who just cares about you
Yeah.
a lot. They're just like they notice something about you. They're like, you know, you should probably talk to a therapist. You know, if something's
Mhm.
wrong, you need somebody to talk to, and you're just like, nah, I'm fine, because this is how I've been all my life.
Yeah, if you're just always like that, then you're not gonna notice like something's off or something's like not normal. That's kind of like me for a while when I first started developing symptoms of anxiety, like when I was in middle school. I knew something was off, but I just kind of just went with it because I thought that was like normal to experience. So,
Yeah, it just like I don't know if I have any like examples, but you know, it just takes somebody just to notice something and then they tell you, and then you know you have to realize that you need the help, or maybe you don't realize it and then you go into there and then it slowly starts to break down and you're like, okay,
Yeah.
I need to learn this and this. Like therapy, they'll teach you a bunch of things like how to work with yourself and not like be your own enemy. So like
yeah.
you aren't like working against yourself all the time. So you know some things even that you learn in therapy could help for the next session, so you can understand what the next
Yes,
session is about.
absolutely. Yeah.
So like
I feel like there's
sometimes-
always like I don't know if you had this experience, but for me there's always like parts with it. It's like and it's also like how my therapist does it. She does it like kind of like an overall like story of like
Mhm.
kind of your life, and maybe we work on certain parts, but
like little
like
arcs,
they all connect
like
together.
little arcs, seasons
Yes. Yes.
of a show.
Yes.
Just like let's go through season 1 first. And then we
Yes.
go to season 2. We're not going to start at season 3, and then season 1, and then season 4, and then season 2. We're going to start in season 1. We're going to work you down. We're going to figure out what is the root cause, and then we're going to go down from there.
Yeah.
And there's not like a conclusion either. It's always like, I mean, like basically therapy should be a routine thing. Like I don't know if I ever got to the point where I was just like I 100% don't need therapy, and I was like, there's
yeah.
definitely a point where I just didn't have it and I wasn't able to access it anymore, and I felt like I was fine. And
Yeah,
but-
where you feel like you're kind of stable, like enough.
Yeah.
Or stable. I don't know what like word to use, or just like okay.
But one thing with that is definitely be on guard, because there can definitely be some points where you're like, yeah, I'm fine, and then something will just come out in your life and then
Yes.
just put you all the way back down, and now you have nobody to talk to.
Yeah,
So,
that's why I think like even now I haven't been in a while. Like I space it out to like a month or every 2 months, just to pick up where I left off, or just continue the work that I did. And I think having space in between gives me enough time to work on myself and to reflect, because I need a lot of like reflect time to reflect on like, hey, what are some like things that Micah might need to, in third person, that
Yeah.
that Micah might need to be aware of, and that space allows me to, because it takes time to develop awareness of like things that you've been dealing with like for your whole life. That takes time.
Because therapy, it's not like the therapist is going to fix everything
No.
you got. They give you little steps, or they'll give you like something to do, and then you got to take that out into the real world, and then you have to put that into your life, and then that enriches you, and you can figure out what you can like keep moving on from there and keep improving.
It's like therapy is kind of finding the way back to yourself, if that makes sense. For me, at least. It's like finding the way back to who you are and working with who you are, instead of, like you said, we're like working against yourself. And yeah, I haven't like I don't want to put you on the spot, but you said you just started.
Yeah.
Did you want to share about like how that experiences went, or did you want to?
I mean, the experience is going great so far. I mean,
Yeah.
but it's still baby steps so far.
Yeah.
We're just trying to break it down and like work through like what I can do.
Mhm.
But it's anything major so far.
Okay.
Like I just had one today, and it was just about like giving back like what I'm feeling, how I'm feeling it, and like what's causing it.
Is it what you expected?
Not really. I have expected like the movies, me laying on a couch.
Oh my gosh,
And
that's another thing I wanted to say, because like even now in media, it's like portrayed as like you're gonna sit on the couch, you're gonna like have your head back,
Screaming at your therapist.
or that. And I've never had, because I never like, I used to have it in person, but like it was never like that. It was more of just, I feel like therapy for me, as an analogy, is like a retreat to kind of go and focus on myself and be directed, have a guide to help me work with things. And it's not like the movies. It's nothing. It was nothing like that. So I think that's another thing that might keep men from doing therapy.
For me, one therapist I really clicked with for a while, we just played games pretty much. Like we'd play chess or ping pong or something, or he'd just give me a little something to do, and we'll just talk back and forth about like something. So that's how it went for me. It wasn't like sometimes he'd just sit across the room, I sit on the couch, and he'd just be like, all right, so how's his life been? And I just keep him up,
Yeah.
So I haven't really saw much of like therapy in movies, so I wouldn't know much about like what
It's
the
funny.
trope is. But
Yeah.
it's definitely, you feel like once you do get comfortable with them, you can definitely like feel that, because you just like it just spills out, like whatever you had pent up just comes out, because you're like, all right, I can tell this person something.
Yeah, because after that, you establish trust and you establish a foundation. You're able to kind of start to be vulnerable, which is another thing. I think that's another thing reason why men might avoid therapy, because that it comes to a place where we have to like face ourselves, and we're not, again, like we said earlier in the episode, we're not like taught how to ask for help or tell someone about like something that's going on. So
Yeah.
it's like learning a new language. Therapy is like learning a new language for a lot of people.
But
Uncharted waters.
like with my experiences, since I have so much, I basically got it into like somewhat stages. Like the first stage is usually like you're just trauma dumping to the therapist. Like you're just telling them what's been going on and like how your life has been, and they just like they pretty much just ask you to summarize everything so they can just understand where you're coming from. And so I just like dump it all out. It's like, here you go. Yeah, and then they get to know you. You get to know them after a little bit, but you don't really get to like the coping and the actual lessons until like a bit in there. So that's when the baby steps, like you told them about your life, you told them what's going on. We're just like figuring out like what do we want from this, like not only because you have to have a goal as well. Like you have to know what you want out of therapy. Like what part of your life do you want to be helped, like socially or relationship wise, or do you just feel like a husk, or like what's going on, like how can I help you?
Yeah, for me, even though like okay, I've been in it for 3 years and there are still things that I'm just kind of discovering, and there's still new things, because I feel like the thing with therapy is just there's always going to be something like new. Not that you always have to work on something, but there's always going to be something like to uncover.
Yeah, they'll definitely tell you something that you didn't even realize. So it'll be like, oh, so you're like this, like, oh, well, I guess so. Yeah, I guess I am like that.
And it takes, like, for me, because I didn't start really working on like the deeper things until actually this year, because I feel like for me, and just for like a lot of men especially, it could take a long time to break through those walls and break through those like years of barriers. I think therapy has definitely like allowed me to be patient with myself and like kind of coming to terms with maybe some areas of weaknesses that I have. So it's definitely allowed me to. Therapy is patience, because you have to be patient with the growth that maybe you like, maybe the goals you have or the growth that you like envision, but at the same time it's not going to come in the time that you feel that you think it should be. And like as you like kind of starting out, that's kind of like my thing. I don't know, you can take that way, but that's something that I've had to learn and I'm still learning, is that you have to allow it to kind of unfold itself, and you're not going to notice especially if you don't. That's also I recommend journaling along with therapy to like kind of track your growth, but you're not really going to notice the changes. The therapist will probably then notice it, because you don't like, you can't like, it's gonna sound weird, but you can't like look outside of yourself. Someone else has to notice that.
Yeah, you're not gonna really like know that you've been. I get what you're saying. Like, you have to have like someone outside, like their opinion, because they've been seeing you grow and like. I definitely understand you. Like,
and sometimes it's hard to believe it, because, like my therapist will say, okay, yeah, you definitely changed in this area, and it's like kind of hard to believe, because I guess like it's something that you don't notice. And I think it's definitely like the fact that you don't notice it doesn't mean that you're not growing. It's just like you have to allow the growth to unfold, and patience is so important when you're either starting therapy or you're still doing therapy. It's just it's important. Yeah. And but I guess like, I don't know, like another barrier is just thinking, as like men thinking, I guess, that it's just talking, and we kind of like associate talking about feelings with more of like it's more like a female thing.
Yeah. Not
to like say anything, but we tend to like think in our minds that, because it was the way we've been socialized, is we think that talking or like the talking therapy, the benefits of talking or working out through your feelings is only like a female thing. And I think that's like another barrier that we have, is that maybe we've been so socialized to disconnect from our emotional experience that we don't associate with it. So we think that associating with it is like something that's like we shouldn't, if that makes sense.
I think something about men might be a little harsh. We got a lot of ignorance. Like,
okay.
We definitely
it is.
we think about these things about therapy. Be like something as simple as journaling down your like emotions, right? You're just like, I don't have to do that. Like, I know how I am. Like,
okay. So is it like a pride
like,
thing,
kind
or is
of
it
pride? But like, it's just definitely like you just don't believe. Like, you don't believe that it's gonna work. You just like
lack of belief.
Yeah, lack of belief or something like that, or just like genuine. Like, I just don't accept this information. It's not gonna work for me. Like journaling my emotions isn't gonna help me at all. Like, I already know how I feel. Like, I don't need to just put it in a piece of paper. I'll be fine. Like, some of these things you're just like yeah, you like disbelieve. You just like, that's not gonna work for me. I know myself. Like, but you definitely, when they tell you to do something and you're just like, I don't think this will work, you definitely gotta, as I said, be open-minded. You gotta try it out. You know, and it might help. Most likely it's going to help. It's going to be like something that you can
scientifically proven.
Yeah, something you can hold on to. Just like if journaling is your thing, they'll just tell you to journal down like your feelings and like how you've been feeling, and just like maybe that can give you some, like maybe that's your way of looking inside yourself, is like, so these thoughts just don't pop up and disappear. You keep looking at them, and maybe you can solve like the reason behind them, the reason why you keep thinking these things.
Oh, wow. Morris is like, okay.
So that's why, like, I guess I just used the harsh word, but ignorance is just like, you definitely just gotta accept it. Be open-minded, maybe.
I don't think it's necessarily a harsh word. I think it's more of like it speaks to maybe the reality of the struggle that men have when it comes to maybe pride, or thinking that, like that mindset that we talked about earlier, is that I already know what to do about the situation, or I should already know what to do about this, and any outside help is going to go against my ego of like, I should already know how to do this.
Because
so maybe that's what it is.
I don't know. That might be seemed as like kiddie, or like, you know, I don't need a diary. Like, I don't know.
Yeah.
Like, they're not saying like, Jimmy, talk to me that today. Like, you just have to like, I feel a little like different today, or just like, if you have a bad thought, or if you have a good thought, if you have something to say and no one to talk to, that's when you journal something. It's like not a diary. It's a way into your brain. It's a way into your mind. It's a way of expression, pretty much. And like, there's multiple ways of expression that they'll teach you, like, other than journaling.
Yeah. And there's, for me, journaling, even like journaling is, for me, I see it as a way to talk to myself and to kind of really go into my mind. Because I think sometimes if we're like, especially if we're on an autopilot, like throughout your day, I think journaling is an opportunity to just sit down and reflect. I think we all need that. Especially in today's world, we're all like busy and like overstimulated.
Also, like,
with a lot of things.
If you're ever in like a bad mindset and you journal down some like things that you just like, you look back in a different mindset, you just like, I don't even know where this came from. Like, it's just
that too.
It's just like, you get to see yourself in a different perspective, and it's just like, wow, okay, and now I have more insight of like how my emotions work and what I can say and what I've been thinking in a certain headspace that I'm not in right now. Like, when I said it then, it sounded like so much more impactful, but now that I'm looking at it, I'm just like, this is not me, or this is me, or whatever you said there, this is like something else, or maybe you can connect with it more. It depends on how you use it and like the specific ways that you decide to journal.
And that definitely encourages me to keep going, knowing that you notice a change that you see in your journal from mine's months or years ago, and you look back, it's like, oh my gosh, like my mindset changed, and you see that there is progress. Like that's like proof of the progress, and that like encourages you to keep going, keep moving forward, and keep doing that. Hi, Angie.
Hi.
So now I don't know like how comfortable you would be like in adding to the discussion, but I kind of wanted to know like your thoughts on like maybe like what are your thoughts?
I think a huge, like also part of like therapy that you have to consider like before going into it is like how honest are you willing to be during sessions?
Yeah.
Because I feel like a lot of people go in and like they're probably afraid or still have a lot of their walls up and they're not willing to be honest. So then like there comes a questioning where it's like, oh well, why isn't this working? Or like why isn't anything changing? And it's like, well, if you're not willing to be honest, like people lie in therapy all the time. People lie to their therapists. And if you're lying to your therapist, like they're gonna give you advice or like they're gonna base what they tell you, what they like, the advice that they give you based on what you tell them. So if you're not willing to be honest, you can't expect things to change. So it's about the mindset and how honest you're also willing to be during sessions.
And I think with going off of what you said, I think for me, because I've had like the struggle of vulnerability with my therapist, is that you need to tell I think like for me, I needed to tell my therapist like, well, don't know if I'm like comfortable like sharing this yet, or I don't know if I'm like comfortable going into this place. And they will like if you say that, then they will understand that. They won't like my therapist, at least, like she won't like pry or like push. It's more of like she'll mention it. She'll mention the subject matter when she feels it's most relevant, and like it's more of like a patient thing. She'll be patient with me because she knows that maybe talking about it is not like the most beneficial thing now.
Yeah.
And I think people you can, like you said, you can like walk in the door and still be afraid to share, and it's more of that fear that I think all men have, the fear of like sharing something because they don't want to. There's a lot of reasons why behind it, but it goes down to, okay, I'm afraid to be this open and honest to someone about like my problems because I don't want to be. I don't know like how it is for you guys, but I don't know if like, is it if you're like being taken advantage of, or if you're being seen, if you're being like
my thing,
if you're vulnerable, like there's a lot of fears.
I think my thing, and maybe other thing with a few other men, is just like you think, because like sometimes I would be talking to my therapist and then we'd get to like some deeper stuff, and I'm just like, I don't know if I can tell them this, and it's not like I think they'll like judge. Well, I think they'll judge me because like I think they'll like hate me for this. Like I think they'll think I'm like crazy or something, or just like think that I'm like a bad person because what I did was bad, and I'm just like, I don't want to be seen in this light. And even though it was something I did in my past, I still don't want to show them that I was capable of that. So
or a mistake.
Yeah.
And I think that's like also important in men's journey with their therapist, is to be open to sharing your mistakes or relapses, because it's so important that you don't like hide in like shame. I think we come with like shame as well that covers our stuff, and we don't want to share that because we don't want to be seen as incompetent in our journey. We want to be seen as, oh, I have it all together. But like the whole point of therapy is like that you don't have to have it all together.
Yeah.
And maybe that's another thing.
That's like something I really struggled with when I was a kid, because I was just so scared that if I told them how I really felt, like they were gonna take me away or something. Like I was scared that they were gonna like if I told them the truth how I like really felt, that they were just gonna put me in like an asylum or something. So I was like, I'm gonna just keep that to myself. So like certain things I tell them and certain things I wouldn't. There was always like a little bit that I would change just so like they didn't get like the full story.
But it doesn't necessarily help the healing process, because I feel like with that openness, first of all, I feel like before we even tell the therapist, we have to be honest and open to ourselves and accept that our own like things, and then we have to then be honest with like the therapist. So yeah. We do need to wrap up soon because I have to go to a meeting, but it was nice having you all here today to talk about therapy. I think we can do definitely like a part 2 to this, to like kind of continue the topic. But do we have any final thoughts? We can go around.
I feel like to answer your question, yes, I do feel like men should definitely take part in going to therapy. It's definitely something that I feel like not a lot of the older generation does, but probably should.
Yeah.
And I feel like the newer generation coming up is definitely starting to think about it and starting to be more open about it. But I definitely think it could help, I think it will help depending on, like who you get, if you click with them, and if you actually are accepting to the information, that you'll definitely like your life will be enriched in your like relationships, your perspective on life, your friendships, or just anything you've been doing, you might have a different perspective on. So yeah, I do think it's a very worthwhile thing to go through.
Interesting.
I'd say just gotta be open-minded for whenever you do decide to go, and like you need to know that when you need help, you need to talk to someone. It may not need to be a friend or a family member, but you always need that outside perspective.
So just like know the signs and be aware of like when you need help.
Yeah.
And yeah.
For anyone who's embarking like on their therapy journey, or like is already there, or sometimes forgets, therapy is not a straight line of like a therapy journey is not a straight line of healing. It's not a straight line of progress. Like,
I wish someone would have told me that.
There will be times where you have like relapses. There's times where you will make progress. There's times where you'll be stagnant, but it's all about like just like being consistent.
Keep trying.
And going and like putting in the effort. So.
Oh, I wish someone would have said that when I started, because it can definitely get discouraging. My final thoughts are, I guess men, if you're feeling hesitant about going to therapy, consider like the perspectives that we laid out today on the episode, and consider how it can be beneficial to you, and maybe go through the misconceptions of therapy. I think we need a misconceptions episode of therapy. But yeah, I consider those things, and yeah, that's all I have.
Thank you for listening.
Thank you for listening. Bye.